Hello, my name is Nathan Huang, and my presentation today is on Addison's disease. So, Addison's disease affects the adrenal glands, which are located on top of the kidneys. These glands produce hormones that can affect one's mood, growth, metabolism, tissue function, as well as regulate the stress response. There's primary and secondary adrenal insufficiency. Primary is when the disease affects the adrenal glands itself, and secondary adrenal insufficiency is when the hypothalamus or pituitary gland can be affected. These glands produce hormones that act as a switch that can turn on or off the production of hormones for the rest of the body. And those two glands are located in the center of the brain. For the physiology, the HPA axis, it's a complex feedback system between the hypothalamus, pituitary gland, and the adrenal glands. This is a negative and positive feedback loop that regulates the mechanisms of stress reaction and immunity. So the axis is started when the hypothalamus secretes CRH. The secretion of CRH can be due to stress. So when when CRH is released, it binds to receptors on the pituitary gland, causing the pituitary gland to release ACTH into the bloodstream. And after that, the ACTH signals the two adrenal glands to produce the final chemical, cortisol. And as cortisol levels rise in the blood, the brain will signal the hypothalamus and pituitary gland to stop producing and secreting as much CRH and ACTH. So for the pathophysiology, like I said, there's two types of Addison's disease. In primary adrenal insufficiency, a person's adrenal cortex doesn't work properly, and this can be due to an autoimmune destruction of the adrenal glands, or which is the most common cause of Addison's disease, or it can be due to infections such as sepsis or tuberculosis, or just trauma to the adrenal glands themselves. And in secondary insufficiency, that occurs when the pituitary gland fails to produce enough ACTH. And anything that can affect the ability to produce ACTH can cause secondary adrenal insufficiency. The causes can include autoimmune diseases, tumors, infections, bleeding of the pituitary gland, as well as traumatic brain injury. And the symptoms are related to the severity of the deficiency in cortisol, as well as the rate of reduction in cortisol level. The most common symptoms would be fatigue, loss of appetite, nausea, vomiting, and diarrhea, as well as muscle weakness. So for diagnosis, treatment AI, diagnosis can be delayed due to non-specific symptoms as well as gradual onset. A diagnosis is established by demonstrating low cortisol and aldosterone levels, high renin levels, and blunt cortisol response with ACTH stimulation. Assessing the adrenal cortex's ability to synthesize cortisol can help determine if the cortisol deficiency is due to primary or secondary adrenal insufficiency. Hormonal replacement for life will be required as treatment, and maintenance therapy aims to provide replacement to maintain a normal glucocorticoid and mineralocorticoid level. Now, the common medications given for this would be hydrocortisone and prednisone. So there's no AI models for Addison's disease right now, or I couldn't find any for humans, but I found stuff that veterinarians use. So veterinarians at UC Davis have developed an algorithm that uses AI to detect Addison's disease in dogs. And the program uses routine blood work to detect patterns that can determine if the dog has Addison's disease. So for demographics, women are more likely than men to develop this disease, and the condition usually occurs most often in people 30 to 50 years of age. And according to the Genetic and Rare Diseases Information Center, as of 9/9/2020, it's estimated that about 6 per 1 million people per year develop Addison's disease. And that's my presentation.